All right. Hello. Good afternoon, everyone. Thank you very much for joining us this afternoon. Okay. Okay. So thank you, everyone, again for joining us. We are live on Facebook Live and on Zoom. On behalf of the Coalition for People's Right to Health, Bantay Bakuna, the Council for Health and Development, and the People's Health Movement Philippines, we welcome everyone to our discussion for today on the TRIPS waiver and the Philippines, a forum on the economic, political, and health implications of this move. Right. So everyone, right, to everyone joining here today. So we will have a discussion today on this very revolutionary move on the TRIPS waiver in the Philippines. We'll discuss that context later, but mostly we are going to look into its economic, political, and health implications. So once again, this is brought to you by the Coalition for People's Right to Health, Bantay Bakuna, the Council for Health and Development, and the People's Health Movement Philippines, together with our civic media partners, Now You Know and Rappler Move PH. Okay, so all right, so everyone, our speakers are here, and the rest of our audience is coming in. All right, so please settle down. Those watching on Facebook Live, please leave your comments and questions. We will read it later during our open forum. So, okay, so I will introduce myself. I am Dr. Josh San Pedro, co-convener for the Coalition for People's Right to Health, and a member of Bantay Bakuna and the community physician of the Council for Health and Development, and also a member of the People's Health Movement Philippines. Okay, so we will start by looking into the nature of this TRIPS waiver. What are we going to discuss today before we go to our esteemed speakers? Okay, so let us discuss first. What is this TRIPS waiver that we are discussing? So what is this TRIPS waiver? So it is definitely tied with the World Trade Organization. Now, the essence of the WTO TRIPS waiver is very much tied to this, and we will have this description now. So the TRIPS is short for the Agreement on Trade-Related Aspects of Intellectual Property Rights, shortened as TRIPS. It is part of the General Agreements on Tariff in Trade, or the GATT, which was negotiated during the Uruguay round of the GATT from 1989 to 1990. So this GATT, when it was being discussed, one of the major aspects is the aspect regarding intellectual property rights, copyrights, and patents. And who would be able to, which organization should be able to police this. This gave rise to the World Trade Organization. So the WTO TRIPS was signed by its member states on 15 April 1994. So this became effective by January 1, 1995, which is also the birth date of the World Trade Organization. So it was established during this time to police the agreement on the TRIPS. So the WTO is definitely its existence is tied with the TRIPS agreements. So it gave these member states a time for them to implement these to be ratified in their own countries. So there was what we call a transition period from 1995 to 1999. So these countries were forced to enforce these agreements because they are member states of the WTO, and thus they had to implement it no later than January 1, 2000. So the transition period was only between January 1, 1995 to December 31, 1999. So since then, the Philippines has implemented the Agreement on Trade-Related Aspects of Intellectual Property Rights as part of its WTO membership. So the TRIPS involves rules on copyrights, patents, and intellectual property rights because it affects all aspects of trade, especially and including medicines and health technologies. So this also meant higher costs for innovator drugs or drugs that were newly invented, especially with patents. Initially, copyrights are under TRIPS. Copyrights last for as long as 50 years, but with regards to medicines, the patents would last for 20 years. even and could be extended up to 5 years. So that would be the time between this innovator drugs being able to make a profit out of their invented medications, and it gave some time before generics were allowed to be used around 20 to 25 years afterward. In the Doha Declaration in 2001, a year later than the enforcement that all member states were required to do, there was a new discussion between member states, the Doha Declaration, which tried to promote the compulsory licensing for generics for more access to medications, especially during the HIV/AIDS epidemic, as well as more and more um, uh, medicines that were being more and, more, and increasingly necessary in the world of pandemics and epidemics and so many other chronic diseases. So despite that, there were still persistence in the application of TRIPS, especially to medicines, especially to health technologies, and it persists up to today. So for COVID-19, there was a discussion on a need to waive some of the aspects of TRIPS. So there was a proposal. So in October, there was a communication sent to the World Trade Organization by South Africa and India for certain provisions of the TRIPS agreement for the prevention, containment, and treatment of COVID-19. So it proposed to waive the patent enforcement of these technologies, which involve vaccines, medications, diagnostic equipment, PPE, and all the other essential technologies to combat COVID 19. So when this was filed in November 2020 to the body of the WTO, eventually it was joined by countries from Africa, Asia, Latin America, and the Pacific. So it has increased in the number of countries which supported it, but the decision kept being deferred. Now, from December 2020, the first discussion about it, even to March 2021, and now the next meeting will be on June 8 to 9, 2021. Now, so no consensus could be reached. So one thing to note about the World Trade Organization is that it decides via consensus. Now, it's not like the UN or the other international bodies that has voting concerns. The World Trade Organization works via consensus. So no consensus could be reached at that time, and thus the decision on the TRIPS waiver was deferred until June 2021. So it was rejected initially outright by a lot of European nations, most of the European Union, as well as some countries like Japan, the United States, Canada, Brazil, Australia, uh, and Switzerland. So these countries deliberately rejected this proposal. To add, the Philippines actually once signified its support, but we haven't actually heard an actual statement. But back then, in around November 26, the Philippines had been one of the countries that had signified agreement with the proposal. But this is basically the how the world looked in terms of supporting the aspect of the TRIPS waiver back in November. So we see a lot of popular support for the patent waiver, especially among international groups such as Doctors Without Borders or Medicine Sans Frontiers, with Oxfam in their People's Vaccine campaign, and the People's Health Movement in the call from the Global South to not block the TRIPS waiver proposal. So these really boil around the call that there should be no patents, no profits, and no monopolies during a pandemic. But all of a sudden, in May 2021, we saw some seismic changes with regards to the TRIPS waiver. All of a sudden, the United States, after much pressure from lobbying groups as well as local politicians in the Congress, the United States, all of a sudden, the WTO representative as well as President Biden decided to reverse its stance and suddenly support the COVID-19 waiver for the patents for COVID-19 technologies, specifically vaccines. And even China supported this intellectual property right waiver in its recent declaration in May 2021. The WHO hailed this as a major monumental moment that would really pave the path towards vaccine equity. but we still have yet to see how it will change the overall geographical and geopolitical structure, especially now with the US agreeing. We have still yet to see how other countries might change its views. For example, Indonesia has suddenly not just agreed with the proposal, but actually co-sponsored the proposal. We see other countries like Mongolia, Fiji, Vanuatu, and many African countries or the African group, as well as Bolivia and Venezuela, supporting the TRIPS waiver. So again, where are the others? Or what are the stances of other countries like Canada, Mexico, and the European Union, as well as Japan, South Korea, and many of the other vaccine producing countries that we will see uh, in as the pandemic proceeds. So we still see, because of all of this, there's this major inequality in the vaccine orders of many countries. So we see that the reality that over 80% of vaccines have already been purchased by rich countries. We hear this a lot from even from the NTF, from the vaccine czar, that there are countries that have ordered way more than their population. So Canada, for example, has purchased 5 to 10 times its population. The UK, Australia, even the US and the European Union have more vaccines than what are needed, while other countries still struggle and still do not have enough vaccines for their population. And there is a need for vaccine diplomacy, where vaccines will be donated to the countries that need it. And it is, although there is an advantage, a comparative advantage for countries that are smaller but have their own production, like Cuba, Malaysia, Indonesia, and Thailand. While countries that are left without these capabilities are also struggling with their infections. So in the Philippines, we have some vaccines. All of our vaccines are imported. 6 with emergency use authorization, 1 with a compassionate special use permit, and we have a 7 vaccine portfolio. But again, the question is, will this arrive to be able to give herd immunity for a country the soonest possible time? We have a lack of local production as opposed to other countries like India, Cuba, Indonesia, and Malaysia. Our country used to have the Alabang Serum and Vaccine Laboratories, which used to be the biological production service of our RITM, but the land was sold to a festival mall in the Alabang. Initially, this vaccine institute produced BCG vaccines for tuberculosis and made anti-cobra venom. But unfortunately, it has languished, and the land has since been sold to Festival Mall. But now there are some changes with regards to its structure. It's being renovated to become a storage facility. But we still see the lack of local production very much prominent during this pandemic. So with the Philippines, of course, without the TRIPS waiver, we don't know how many inoculations we really have to do per day, if it is doable by the plan for November 2021 that we would reach the 60 to 70% target. So this is something that we have yet to see. That's the big question. Where is the support for the WTO TRIPS waiver, especially from the relevant institutions that would ensure such a major legislation or such a major move on behalf of international solidarity to really change the situation of our pandemic. And that is something we have yet to see from these institutions that really could make this possible. So that is what we'll be discussing today. What are the implications of the WTO TRIPS waiver with regards to the Philippines, with regards to making sure that this will be a reality? Okay, so we go back to the question, what are the implications, the economic, political, technological, and health implications? And that's something we'll be discussing today. Okay, so for our first speaker, who will discuss on the economic and financial implications of the TRIPS waiver, our history with the TRIPS, as well as the implications of supporting such a waiver, such a proposal. Our first speaker is from Ibon Foundation. He's the chair and also finished his studies in economics from from the London School of Economics. So I present to you Mr. Sunny Africa, who will be our first speaker for today.
Good afternoon, Josh. I have to apologize. Our internet in the office isn't working well. Can I ask for your assistance to flash the slides? I shared the.
Right.
Thank you. I'm so sorry. Okay. I think I'll just deepen on some of the points that Doc Josh already raised. No. Before anything, I think it's important to stress that the longer we create these artificial scarcities because of market-driven monopolies, the more the pandemic becomes really a man-made capitalist-driven catastrophe. I think that's quite important to stress because we're long past the point that it's just a natural event that we have no control over. Many things right now we do have control over, and the vaccine clearly is something we do have control over. Of course, in terms of the next stage of pandemic response, vaccination, it's clear that we need to waive intellectual property rights, but also transfer the knowledge, skills, and capacity. And I think very many people are supportive of this because this is the key to vaccinating the majority of the world's population, possible within a year with a waiver of the TRIPS provisions, and also lead to stop the spread of the pandemic and continued suffering. Next slide, please, Josh. Thank you. Um, First, just some context. I think in the Philippine case, as it is, the Duterte government has de facto had a vaccine-obsessed strategy since the beginning. The lack of attention to other public health measures like testing, tracing, and all of that. I think that goes to show how really from the start, the government has been very vaccine-obsessed, and unfortunately overusing the lockdowns, very destructive to control COVID-19 while waiting for the vaccine. Next slide, please. The result of that, I think, is well known. It's the severe health and economic crisis, which is dragging on for over a year now, again, while we're made to wait for the vaccine. But again, we have to stress this. The spread of COVID could have been mitigated with better testing, tracing, and quarantines, and the burdens and difficulties faced by tens of millions of Filipinos could have been mitigated with more ayuda and more enterprise support. Next slide. Now, having said that, that's our immediate problem. Of course, vaccines have a key role to play in terms of the COVID response. The vaccine really is the key to medium and long-term recovery and getting that normalcy, whatever we think that normalcy is. So in a general sense, the really super fast development of the COVID vaccine, record time, I think, for a major vaccine, that's of course very good news. But the thing is, developing it fast was good, but developing it fast isn't enough. We need not just to have the vaccine there, it has to be one produced at the scale needed by the majority of the population, and of course also priced affordably. And in a market-driven environment, that's the only way to make sure that the vaccine is allocated according to need. In the meantime, without the vaccine coming in enough quantities globally and with inefficiency in local deployment, the Philippine crisis will drag on. So I think that's the most important benefit of the vaccine for us. Next slide, please. It's of course straightforward, and maybe the reason also why the government was so obsessed about the vaccine. It's true. The vaccine is needed to achieve herd immunity. It is needed for more rapid economic recovery. And if anyone who agrees with that general conclusion also has to agree, a TRIPS waiver will promise even faster, even cheaper herd immunity, and even more rapid recovery. Next slide. The next few slides are just, I think, updating some of the data that Josh already said, but of course, worth highlighting. So although the vaccine was developed quickly, it's being distributed inequitably, and which just prolongs the pandemic for everyone. Josh mentioned how rich countries have over-ordered vaccines, and they've ordered enough to vaccinate their populations many times over. This is the latest data from Duke University. The low-income, middle-income countries with 85% of the global population, they only account for 30%, 34% of the doses purchased. So flipping that on its side, on its head, it means that the high-income countries with 15% of the global population actually have 76%, 67% of the all vaccines. So that overbuying is, that's called that so-called vaccine nationalism. Now, there are huge global gaps, and many countries really won't be able to complete their vaccination programs until 2023 or 2024, especially the lower income countries and the middle income countries. If you go through the news reports and you do a crude adding up of the vaccine manufacturers' production forecasts, they give the impression that we'll produce about 12 billion vaccines by the end of 2021 and another 18 billion by the end of next year. I think so many experts, including a couple of Nobel Prize winners and even former staff of the vaccine manufacturers, they said that it's more likely that that 12 billion figure at current production rates won't be achieved until the end of next year. I think that's stress because although there are many countries with vaccine production capacity, with only a handful of corporations licensed to be able to produce that vaccine, that really blocks production. Now, a common complaint is that there isn't really enough vaccine manufacturing capacity worldwide. That's not true. There are literally 20, 30 countries around the world with the capacity to produce, especially the mRNA vaccine, in 3 to 4 months. It can be produced quickly if only the TRIPS waiver was produced. Next slide, please. I'll go through this very quickly. The next slide just stresses really how inequitable the access is in absolute terms, with the EU, the US, and Canada among the biggest purchasers. Next slide, please. And this is the update on what Josh said from the other day. For the inequitable access on a per capita basis, despite these vaccines, developed mainly with government subsidies, the 6 front-running vaccine developers got over $12 billion in government subsidies. Despite these huge government subsidies, which are public funds, because of the tight grip on intellectual property rights on the COVID vaccine knowledge monopoly by big pharmaceutical firms, this is the end result of that. You have countries like Canada, the UK, the EU, and the US purchasing many times more than their populations, 10 times in the case of Canada, whereas countries like the Philippines, well, we have commitments to get just exactly what we needed. And worst is, of course, for the lowest income countries and the lowest income groups, even within countries, where it's at least 2 to 3 years before they will get their vaccinations. Next slide, please. This is a quick overview of the Philippine vaccination plan. We're targeting 70 million for 2021, 42 million next year, then 2 million in 2023. As with so many things about government targets, these are targets to, dazzle people that, something's happening, the government has your back. But in the real world, if that's the plan, next slide, please. The reality, approaching mid-year, we're actually still looking for vaccines. Even just for the proposed 70 million Filipinos for vaccination by 2021, that needs at least 140 million doses, not yet counting the wastage and other problems along the way. If the government needs 140 million doses, so it's promised 70 million people vaccinated by the end of the year, as of May, we have less than 8 million doses received to date, just 7.8 million. And even if you add the promises, which this government is fund is doing, all the promised doses coming in, including a huge 80 million coming in the last few months of the year, that's actually not even enough so far. Just 109.1 million doses are expected for 2020. So when the task force keeps saying that these rich countries are hoarding it, well, we're actually feeding that. We are also having a hard time getting enough vaccines that we need. Next slide, please. So that's one major gain from the vaccine: bigger supply, bigger production, cheaper vaccines, faster supply faster herd immunity. Second major benefit we could get from a TRIPS waiver is it does create opportunities for Philippine industrial development. Not in a comprehensive way, but the Philippines is so backward. Literally, every little step is a step forward. Next slide, please. The TRIPS waiver creates opportunities for Philippine development because it's a huge chance for Filipino firms to develop capacity that they have or to start building capacity that they don't have, especially, which has to be stressed, especially the Philippine government makes a decision production of vaccines. But I think what when Josh outlined the TRIPS waiver, it doesn't actually just cover vaccine, although that's the headline product that's going to have IPR relaxed. It covers actually vaccine production, diagnostic kits, therapeutics, technically even masks, ventilators, contact tracing apps. Now, it's important to highlight that whole range of products that and goods that might be waived by whose technology will be waived by the TRIPS waiver, because that kind of sharing of knowledge, technology, and data, and the opportunities it creates for Filipino firms to produce these things in themselves, they already will jumpstart industrial progress. Of course, it's another thing how long the use of the technology will be allowed, but the fact that it is there, the fact that there's collaboration happening, the fact that Filipinos and Filipino firms, Filipino scientists, Filipino doctors, medical professionals have that knowledge, technology, and data, that is a stock of knowledge and science and technology for us to build our national industries. So just to take some examples of how industrial development could potentially be created and pushed with the TRIPS waiver. First, in terms of vaccine production, this question is a matter of actual vaccine manufacturing. Josh already mentioned the recent experience of RITM, Biologicals Manufacturing Division, producing the BCG and the COBRA vaccines. It's very rudimentary, but at least it is there. So, of course, the COVID vaccines are much more complex, involving much more complex technologies. But those aren't just the only things that we have to focus on, because vaccines, depending on the kind, mRNA needs about 100 components. Other vaccines need about 200 components. The Philippines can also potentially get the industrial knowledge to produce glass vials, filters, resin, tubing, disposable bags, literally everything to do with producing that vaccine. So if we can actually do the high-end, high-tech portion of vaccine manufacturing, it is possible if we do a survey of Philippine industrial capacity to provide the raw materials and at least the equipment and the inputs for that vaccine manufacturing process. Of course, that needs an inventory of what, not just what we have, but what we could potentially have in short order, especially with enough government support. The other things, I think, my only concrete example really is in terms of developing diagnostic kits. The fact that last year, even without these kinds of technology sharing agreements, UP COVID-19 test kits were developed. That also shows that we have a germ of the capacity there, just has to be nourished further. I probably sort of want to conclude. The TRIPS waiver, it really is a big deal, but unfortunately, it's just the first step. The TRIPS waiver only addresses the legal side of the problem of vaccine production and all these other things. And as just a first step, equally critical is ensuring that there's training of staff and personnel. The knowledge and skills have to be transferred. There has to be investments in the infrastructure, whether for the equipment, machinery, even access to raw materials, if not provided on a by private firms, provided by the government. And of course, ultimately assistance in building facilities, whether retrofitting our old RITM plants, if even possible, or building new plants. Of course, all of this with due attention to standards and quality control. Now, if you multiply the possibilities, not just for the vaccine production, but for diagnostic kits, therapeutics, to reduce the severity duration of the virus, and all the other maybe lower technology things that the Philippines could potentially produce, all these could all be baby steps towards industrial development. And that's one very good thing that could come out of the crisis. Last point, I'm just to conclude this. The TRIPS waiver really is important. It's in the right direction, but it's just a step in the right direction. In the end, we do need also acceptance and the efficient deployment of doses. And again, as it is right now, we're only averaging about 42,000 doses a day. At this rate, it'll take over 9 years to complete 140 million doses. And basically, as of today, until the end of the year, to complete 140 million doses, we need to do over 600,000 doses a day. So we have a huge range of concerns. The vaccine production is important. The TRIPS waiver is a start, but of course, ultimately, we have to improve the overall response of the government. That's it. Thank you. Thanks, Josh.
Okay, thank you very much, Sir Sunny. On behalf of, again, Coalition for People's Right to Health, Bantay Bakuna, CHT, and PHM Philippines, we'd like to thank Ibon Foundation for their inputs regarding the economic and financial aspect of the TRIPS waiver. Right. So as Sir Sunny mentioned earlier, any improvement in terms of the Philippines' neglected capacity to improve its healthcare as well as its infrastructure, it is a major achievement in itself, if there is even that is how low that we have set the bar, and thus we must really raise the bar when it comes to our standards in healthcare, in science and technology, and improving our local capacity to be able to take care of ourselves in terms of vaccines, medicines, diagnostics, and even research. So towards that, we will now go to our second speaker, who will discuss the science and the technological aspect of of the TRIPS waiver, as well as the implications of this for the Philippine science and technology sector. We have Engineer Reynaldo L. Esguerra, the chair of the Pro People Engineers and Leaders, or PROPEL. He also works as the chief of the Environmental and Biotechnology Division of the Department of Science and Technology, the Industrial Technology Development Institute. So without further ado, I give the floor now to Engineer Ray Esguerra. Good afternoon, sir.
Good afternoon, Dr. Joss, and to all the viewers of this program. So, well, last night I was requested to do this, and I did have some misunderstanding, but as I clarified with Dr. Joss earlier. So let me just present to you. Well, first I'd start off with my own personal views, and then present to you what the OST is doing in terms of virology and vaccine research, and then eventually go back to my hat as interim chair of the Pro People and Engineers, Leaders and Engineers. So, well, this was the treat. I saw it only yesterday, but very important, as Sunny mentioned earlier, about having waiving the costs or the royalties for intellectual property rights. Maybe a lot of you have read about how the cost of medicine have been driven up high by some companies. Although my slight okay, again, this has been shown. I think this will be the third time you'll be seeing this from Dr. Joss and Sunny about this one. But again, I'd like to share an editorial cartoon prepared by my doctor friend, Dr. Net Billones, used to be the editorial cartoonist of Malaya, and you'd see that the new normal is still the usual. The rich nation still controls all these things. And well, right now, very recently, in the news, they said that the government is eyeing private sector to lead the vaccine manufacturing in the country. My slight discomfort in this one is, well, if you look at the list of the companies that would set up the manufacturing, vaccine manufacturing in the Philippines, would be mostly, I would say, either multinational companies or companies from abroad, and they would be really part of the developer of the vaccine. Now, again, as I've said earlier, sometimes even if the IP or the royalty has been waived, then who knows what what other added costs would be incorporated into the selling price of the vaccine. The other thing is, if these investments would be made, then typically they try to recover their investments very quickly. So now let me just move to, so what are we doing at the OST? So at the OST, now I'm changing my hat to my official job. So at the OST, we have proposed the establishment of the Virology and Vaccine Institute of the Philippines. Now, of course, this is too late for the development of vaccine for COVID-19. However, the thing is, aside from the COVID, there are other viruses that would be prevalent for you affecting human health. And aside from the human health, we do have also the problems of viruses affecting the animals and plants. So that's why the concept of having a virology institute in the country has been proposed by DOST since May of last year. So our secretary made this announcement during an infrastructure cluster meeting last June, and eventually, what the institute is not only for DOST use. So our undersecretary in a recent National Research Council of the Philippines forum mentioned that the institute, the facilities would be available to those who would be doing research, both local and foreign researchers who'd like to do research on virology, vaccines, therapeutics, and others related to this concept. So again, this will be the research on diagnostics, therapeutics, and vaccines that eventually will be developing in the country. So what has happened recently, again, the site, the Basis Conversion Development Authority had set aside 5 hectares of property at the Clark New City for where we would be setting up the virology. Immediately after the declaration of our secretary, Senator Lacson already filed a bill in the Senate about creating the VIP, and we have the OST initially provided a small amount just to start up the program. So this is just to give you an architectural view of what would be established. However, last year, the DBM approved the release of, for this year, 284 million, really to jumpstart the activities for the institute. And at the lower house, eventually it was the Committee on Health and Science and Technology approved the bill for creation of the Virology Institute. And at the as of May 22, the Committee on Appropriations approved its providing budget for it, but still we do really have to have the bill at the Senate finally approved, so that the joint houses could eventually come up with the bill. So, and we'll be tapping not only local experts, but we've invited back into the country some of our scientists who are into virology, not only on human health, but also on animal and plants. So we've also developed the roadmap for it, and maybe what I could share also would be in terms of the technology transfer. So over the next few years, we're looking at the transferring. Well, the institute would focus only on the research, and then eventually, when it comes to the actual manufacturing, it would be transferred to the pharmaceutical industry. Although, of course, we've had discussion among our groups that sometimes they would always say that if government runs it, it's inefficient. But if private sector runs it, then maybe profit takes over. So we're having this kind of discussions among our groups. Now, of course, what the priorities of identifying which diseases would be addressed would include those that had been studied previously, those where we had linkages, those with current researches, and then looking at the relevance of diseases in the country. So maybe again, Mr. Sunny Africa mentioned earlier, this could drive industrial development in the country because, well, as I've said in our organization at Propel, we simply have almost 110 million Filipinos. This could be your customers, and this could be your producers likewise. So, in fact, I've been pointing out that we've survived this very, very long lockdown because we relied on each other. So, so that eventually, if we could create this opportunity here in the country, we'll have not only the 7 scientists that we mentioned earlier, but also the other experts so that we could provide this opportunity. So eventually, if we could produce those vaccines, we would, as mentioned earlier, this would support the pharmaceutical industries and all the other support requirements, like as mentioned by Mr. Africa earlier about the packaging of this, the even eventually how to properly dispose of all the waste materials of this. Eventually, if they could provide the requirements for our Filipinos. So, well, as our at the OST we call science for the people. So I hope that we really could finally address not only the COVID problem, but also the persistent problem of why people really have to go abroad, why we have to export everything and then import the finished products. I think we do have the resources, we have the people, we eventually will have the technology to do all this for the country. Thank you and good afternoon.
All right, thank you very much, Engineer Ray, for really highlighting the aspect now that we have really over COVIDized, no, or there is a COVIDization of our situation in terms of science and technology. That we're not only really dealing with the virus of COVID-19 or SARS-CoV-2, we have so many other virological problems in the Philippines, and perhaps the TRIPS waiver, as well as really industrializing our country, would really help towards a larger or even a greater scale of self-sufficiency and development of our healthcare sector, and the wider cooperation of the different sectors towards a better level of health for our country. All right, so thank you very much again, Engineer Ray. We hope to hear from you more later during our open forum. All right. So during this time, again, I'd like to remind everyone that for those in our Zoom, if you could please fill up our attendance sheet, and for those in our Facebook Live, you can leave some comments or questions that we will ask our speakers for later. Okay, so just a quick reminder. So this forum is presented by the Coalition for People's Right to Health, Bantay Bakuna, Council for Health and Development, and the People's Health Movement Philippines. Thank you again to our civic media partners, Now You Know, and Rappler MovePH. Okay, so at this point, before we move on to our next speakers, again, thank you to our previous speakers, and we would like to acknowledge some of the viewers and colleagues that we have here during our forum. So we have the Health Action Information Network, the Women's Global Network for Reproductive Rights, the Asian Health Institute. We have some visitors here from Japan as well. We have the Philippines Australia Solidarity Association, and uh, other organizations including Health for the People Brigade in the Cordillera Administrative Region, as well as some fellow colleagues, health professionals from the University of the Philippines, Manila. Okay, so again, maraming salamat sa lahat ng mga nanonood sa atin ngayon. Okay, so we will now proceed. So as mentioned by Engineer Ray earlier, we have a lot of concerns with regards to strengthening our capacity for healthcare, and this involves a lot of legal challenges. So he mentioned earlier the need for legislation to strengthen our health capacity, and towards maybe this TRIPS waiver, there are even greater legal challenges ahead that may pose some blockages towards its passing, but hopefully we have the political will to push towards a TRIPS waiver and an overall strengthening of our healthcare capacity as well as research capacity for a stronger level of healthcare in our country. Okay, so for our next speaker is a legislative is from the legislative sector. She is a congressman as well, a congresswoman, sorry, on as part of the 18th Congress. She is a representative of Gabriela Women's Party List. I'd like to welcome to the floor Congresswoman Arlene Brosas to discuss now the legal implications of the TRIPS waiver and the larger political arena that we have to hurdle through in terms of vaccine equity and the right to health in our country.
Thank you, Josh. Maraming salamat. Thank you, Josh, for inviting us to the TRIPS waiver in the Philippines, a forum on the economic health and political implications. First, we would like to discuss what are we doing right now in the legislative. We have some recommendations to give you with regards to this. First, we are going to file a resolution, a draft resolution on the TRIPS waiver support, because as you know, from the latest in Congress, even though we have lots of hearing in the Committee on Health, there was no mention of the TRIPS waiver. So apparently, even the legislators do not know the TRIPS waiver, the support for the TRIPS waiver that we need right now. In fact, we were answered by a certain member of the executive that they have no knowledge of the stand of the Philippines with regards to the support for the waiver. So they don't know anything. So meanwhile, I'll just share the screen so you can see the draft presentation. So we have two recommendations actually: the filing of the resolution, and second is we think we can support you by giving the open letter for the executive agencies and to other legislators that will probably support this waiver. And that's it. That's the two recommendations that we know will help in this endeavor. So let me go line by line with this, so you can see the draft resolution, or I can read it. So it is a resolution urging the Philippine government to sign and unconditionally support the trade-related aspects of intellectual property rights TRIPS waiver at the World Trade Organization, WTO, for the prevention, containment, and treatment of COVID-19. So it is stated in Article 2, Section 15 of the 1987 Constitution that the state shall protect and promote the right to health of the people and instill health consciousness among them. Next, under the same Constitution, in Article 13, Section 11, it is provided that the state shall adopt an integrated and comprehensive approach to health development, which shall endeavor to make essential goods, health, and other social services available to all the people at affordable cost. Whereas also in the aforementioned Article 13, Section 12, it is written that the state shall establish and maintain an effective drug regulatory system and undertake appropriate health, manpower, development, and research responsive to the country's health needs and problems. And now is seamlessly the time to uphold the above quoted constitutional imperatives, especially given the circumstances that the country has been on endless lockdowns since the start of the spread of COVID-19 March last year. And whereas to date, the Philippines has only inoculated less than 1% of its population of more than 108 million people from the vaccine tracker of DOH. Whereas while the vaccine rollout steadily remains to be inefficient, the Philippines' total number of COVID-19 cases is at 1,188,672, with death tolls now at 20,019, with the average of 1,200 cases per day. And whereas since May 29, 2020, the World Health Organization proposed a COVID Technology Access Pool, CTAP, designed to share knowledge to rapidly scale up vaccine production, but the vaccine companies refused to participate. And whereas consequently, high drug price is dictated through the World Trade Organization, trade-related aspects of intellectual property rights or WTO TRIPS agreement. Whereas under TRIPS, transnational drug companies have the right to impose patents on their products, meaning they gain the right to exclusively manufacture, use, and sell patented medicine. Each patent has a minimum effectivity of 20 years. And whereas rules on granting patents legitimizes expensive pricing and favors the interests of pharmaceutical companies for profits over people's right to access to affordable medicines. And whereas measures to ensure access to quality medicines should not compromise access to medicines. Whereas on October 2, 2020, at the meeting of the WTO TRIPS Council, India and South Africa proposed for a temporary waiver of certain TRIPS obligations in response to the raging COVID-19 pandemic. This proposal aims to waive off all kinds of intellectual property, such as patents, industrial designs, trade secrets, and copyright from all COVID-19 related medical tools. Whereas according to the proponents, the objective is to avoid barriers to the timely access to affordable vaccines and medicines, or to scaling up of research, development, manufacturing, and supply of essential medical products. Whereas on November 9, 2020, this has been co-sponsored by the delegations of Bolivia, Egypt, Eswatini, Fiji, India, Indonesia, Kenya, Maldives, Mozambique, Mongolia, Namibia, Pakistan, South Africa, Vanuatu, the Bolivarian Republic of Venezuela, and Zimbabwe. Over 100 developing countries have joined the effort and also supported the proposal. Whereas last February 15, 2021, open letters on the waiver have been sent to policymakers of countries that are uncertain on the process, including to the representatives of the European Commission, United Kingdom, Germany, France, Spain, Italy, Netherlands, Norway, Denmark, Canada, Japan, and Australia. And whereas on May 8, 2021, the United States government recently agreed for text-based negotiations and declared that it will support the TRIPS waiver. And whereas on May 23, 2021, just 3 days ago, Indonesia backed a revised proposal with a duration of 3 years, with 62 co-sponsors to waive patent regulations that might allow for faster and better vaccine distribution and procurement. And whereas the TRIPS waiver reiterates the importance in assuring availability and accessibility of all health and medical products, including personal protective equipment, vaccines, medicines, and diagnostics, to confront the COVID-19 pandemic. The TRIPS, whereas the TRIPS waiver is admittedly a recognition of the urgency to act on the global health emergency happening now and a reflection of the stand that access to healthcare, to COVID-19 health technologies must be universal, must be for the general public. Whereas if the waiver is to be adopted, strong and clear advocacy is needed now, particularly directed to those governments like the Philippines who are quiet and supporting the proposal in the TRIPS Council. Whereas with the emerging pandemic, public health should be the Philippine government's top priority. And whereas the current healthcare system of the country is more on out-of-pocket spending, more commercialized and privatized, this is not the healthcare system the people need. According to the People's Health Movement, economic growth and development depends on a healthy population, and the healthy population needs strong health systems. And whereas the government should focus efforts in guaranteeing free and accessible health services for all Filipinos, and should take hold and proactive measures in doing so to significantly make a difference in protecting the population from COVID-19. So now, therefore, actually, this is the last part of the resolution. Be it resolved that the Philippine government sign and unconditionally support the trade-related aspects of intellectual property rights TRIPS waiver at the World Trade Organization, WTO, for the prevention, containment, and treatment of COVID-19. Together with the people, we continue to push for a free, comprehensive, progressive, and unified public healthcare system that is anchored on the principle of health as a fundamental human right. So now, Josh, we are going to open the discussion on certain provisions. If you want it to, to enhance it or to give suggestions regarding the provisions, we are open for it, for any changes. Now, the second recommendation is there is this letter, going around, the open letter for civil society, NGOs, etc. We can also probably find ways, to give this to the legislators and to the different executive agencies, and so they can manifest their support in the waiver, particularly. So those are the two actions that Makabayan Block can do for you, for all of us, and I hope this helps the presentation. Thank you very much.
All right, thank you very much, Kong Arlene Rosas, Representative Rosas, for that. No, it was a major sharing. We've seen the TRIPS waiver for over 6 months already since it was first filed in November, and yet the deafening silence from the Philippine government is really alarming, despite the fact that the Philippines keeps on mentioning, so si General Galvez keeps saying that the 80% of the vaccines have already been procured by rich countries, but what are we going to do about that? Despite having some vaccines arriving, of course, there is that major concern of vaccine inequity in the world. So talagang kailangan natin gawan ng paraan, especially with regards to making this government realize that it's more than our own problem, that we really have to talk about solidarity and really supporting a wider move to make health a right through removing barriers such as profit, monopolies, and the the lack of development of local infrastructure that was mentioned by our speakers. No? So thank you very much to Kong Arlene, Gabriela Partilis, and the rest of the Makabayan Bloc, no, for sponsoring a resolution that will push our government and other government agencies to really support the TRIPS waiver. No? So to remind everyone, so the Philippines is has mentioned support for the TRIPS waiver in earlier WTO meetings, but we have yet to see an actual firm commitment, and really calling for the approval of this TRIPS waiver. So in the Association of Southeast Asian Nations, only Indonesia has really pushed for its inclusion, but the rest of the countries are still wavering on the waiver. No? So that is something that we hope, no, that the Philippines would change its position and really, no, explicitly support it, just as what Kong Arlene mentioned in the need for a resolution and a stronger commitment, no, towards health as a right of the people. So with regards to that, okay, so we will now move on to our last speaker, who is also the country coordinator of the People's Health Movement, no, especially in really pushing in our campaign for the people's right to health in the Philippines, to greater equity in healthcare internationally as well as locally. Dr. Edelina de la Paz is also the chair of the Health Alliance for Democracy, and I would like to give the floor to Dr. Delen de la Paz to react on the health implications of the TRIPS waiver in our country.
Thank you very much, Josh. Good afternoon, everybody. Magandang hapon sa ating lahat. Thank you so much for the Coalition for the People's Right to Health for this forum that People's Health Movement is also co-sponsoring. Because indeed, the TRIPS waiver is one area of concern that we really have to push because it will really affect our response to the COVID pandemic right now. So I'd like to acknowledge here the slides of Dr. T. Sundararaman, the Global Coordinator of the People's Health Movement, who presented some of these slides also in the recent webinar we had last April 7, World Health Day, where we also tackled the aspect of TRIPS waiver. So let me move on. So this is my outline. Actually, the first part of this has really been mentioned already by Sunny and by Josh. So pasadahan lang. Nabanggit na rin earlier, no, that this is really TRIPS referred to the trade-related aspects of intellectual property rights. One of the 4 agreements in the Uruguay. In the World Trade Organization that was ratified by member countries in 1995, but it was actually part of the GATT, the General Agreement on Tariff and Trade. So when they say it might be difficult to ask for a TRIPS waiver, it has previously been done. The Doha Declaration actually is a waiver of the WTO agreements, also on TRIPS during the time of the heightened problem of HIV/AIDS and also the problem of access to medicines for HIV/AIDS patients. But they were able to push for a declaration that would allow compulsory licensing and parallel imports that would make the cost of medicines for HIV more affordable and accessible to the people. So the Doha Declaration was a victory for people's struggles for access to HIV drugs. So in a way, it was like a TRIPS waiver also for the HIV drugs. So people are saying, let's not push for a TRIPS waiver anymore because the TRIPS flexibilities are there, but we say that the TRIPS flexibilities are not enough. What are they? These are the compulsory licensing and the parallel imports, because you'll have to do this on a country-to-country basis, and then you have to do it on a product-to-product basis. We are in a pandemic situation. We need immediate action, and therefore WTO should now really say that, yes, we agree to a TRIPS waiver for all the products related to COVID-19. So it's not just vaccines. It includes also technology. It includes masks. It includes testing kits. It includes other medical and other technologies that would be supportive of a response to immediately decrease COVID-19 cases. So we're saying TRIPS flexibilities are not enough. So TRIPS waiver indeed has to be worked out. So what are the implications of this? This has been already discussed, that this was really introduced by South Africa and India in the WTO meetings, but and it has been supported by many countries already, and the latest one of which is Indonesia. So there's another meeting come June that will possibly discuss this more extensively, and we really need to rally those countries that haven't voted yet, including the Philippines, that they should support the TRIPS waiver. So this has been discussed already earlier. So when the rich countries say, oh, you don't need a TRIPS waiver because IPR is not a barrier to innovation and production, we say this is not true, because we know that with the intellectual property rights, then you limit the access of people to this knowledge because you control it. You make people pay for it. Whereas if you have the TRIPS waiver, then you can already allow those countries with manufacturing capacities to already produce the drug without necessarily having to rely only on the innovator companies to produce the drugs or the vaccines and other technologies related to COVID-19. The pharma companies are providing voluntary licenses to low middle income companies. Some of them have provided, but this is not good enough. And really, many of the pharma companies are thinking more of profit rather than sharing their knowledge. And also the TRIPS flexibilities do not suffice, and intellectual property is essential for innovation of new drugs and vaccines. This is what countries are saying, that with intellectual property, you are more motivated to produce because your intellectual knowledge is being recognized and protected. But we're saying this is not true, because the knowledge for health should actually be a shared knowledge, because it means addressing life, addressing people's quality life. So the TRIPS waiver is just actually a temporary waiver until we get over this pandemic. So the the companies must not be very much threatened that they will lose profit. But of course, this is the height of profiteering for them, because this is when the people need the vaccines and medicines most. But again, it's a question is, what do we prioritize, profit or health? So if TRIPS, the TRIPS waiver also saying that it would allow countries who are WTO members to choose to neither grant nor enforce patents. So they were saying it's a free choice for the countries, but what we're saying is this will really prolong the process, so might as well make it a WTO ruling. So the waiver here is also for not just for the vaccines, but all other related products for COVID-19. This we're also saying, as I mentioned already, the waiver will also remove the monopolies, as what we have seen. The countries are controlling the manufacture, the production, and the distribution of the vaccines in the name of vaccine nationalism, but they're getting much more than what they need. So we hope that this will really promote the sharing of the products, as well as lowering costs of the products. So wealthy nations representing just 13% of the world's population have already cornered more than half, or 51%, of the promised doses of leading COVID-19 vaccine candidates. So most countries would really, the developing countries, or sorry, those countries that have produced the vaccines are actually limiting the exportation of these vaccines. So in a situation as critical as the present, the exceptional nature of the measures demanded from the majority of the population must also apply to the private pharmaceutical industry and its permanent thirst for profit. So we have to address that the question here is not anymore development for them, but the development was really for whom? It's for the people, so it should be shared. The COVAX was a facility created by global health institutions to facilitate access to vaccines, but this is also made up of big pharma, and the limitations here is they're only giving priority to around 20% of the population as free in the COVAX context, and the rest will be at market rates. So what we are receiving right now in the Philippines are actually vaccines coursed through COVAX. That's why they are free. But the problem with the Philippine government we are just relying on this free vaccine. So that's only 20% of the population. So why don't we really push for the waiver so that we can be able to buy at a much cheaper cost the other vaccines? So, so the question here is, which do you prioritize? Profit over people or people over profit? So even if there is philanthropy and public-private initiatives, this is not the answer, because there is also a failure of the COVAX or the CTAP, the COVID technology access pool, because it's also controlled really by the rich countries. So it has to be a more decisive decision of WTO. So this is our position here because of its big implication on health. We really say that health is not a commodity, it is a right. And therefore, we should demand that whatever will support the people's right to health, the people's right to life, should be what is promoted. So economic recovery cannot be at the expense of health or the rights of the majority. We must choose capital or life. And together with local, national, and international groups and organizations, we must act quickly and forcefully, create a global strategy of equal access and universal guarantee to high quality of health care. So we are seeing here the problem of small and developing countries where they are not able to access these vaccines because the bigger countries have already garnered the majority of the vaccines. We support the TRIPS waiver, the suspension of private patents on all technology, knowledge, treatment, and vaccines related to COVID-19. So we really are supporting the suspension of the patents. As mentioned earlier, patent protection under WTO spans 20 years. So for 20 years, nobody else could produce that drug that has been innovated except the innovator company. And who dictates the price? It is the company that dictates the price. So for now, we really say it should be suspended, and access to this production of medicines and vaccines should be made available to all with the capacity to produce these drugs. The elimination of trade secrets and the publication of information on the production costs and public investments used in a clear and publicly accessible manner. So there should be transparency in information, and public should have this, can scrutinize at all stages of vaccine development up to deployment. So this was the issue we had with Sinovac, because when Sinovac was rolled out in the Philippines, we didn't even have a published phase 3 clinical trial that will show the effect of the vaccine on the various age groups that will be receiving the vaccine. So there was no study for the elderly for Sinovac. So how can you recommend it to the elderly if you have no basis for it? So this is something that you have to really demand for, that there should be transparency and develop of the development at all stages of the vaccine development. And again, we demand for universal, free, and open access to vaccination and treatment. The expropriation and socialization under popular of the private pharmaceutical industry as a basis for a universal public health system that promotes the production of generic treatments and medicines. So again, private pharmaceutical industry should be able to release their information and not limit it to themselves, but open it to the public health system. Increase budgets for public health and community care policies, including more staff, higher salaries, and improved working conditions in these sectors. So the government should look at this also from the context of public health and support the mechanisms that would really make sure that public health and community care is prioritized. So people are saying, oh, we don't have the money for this, but Ibon has already published several articles saying that if we increase taxes on wealth, especially on the wealth and income of the richest 1% of our population, we can finance the effort against the pandemic. It's a sad reality that we really have a very bad taxation system in the Philippines, where the poor are taxed more because everything we buy has a value added tax to it, whereas the rich are able to get their tax holidays. And so we lose on this as our revenue. So if this can be strengthened, the collection of taxes on the wealthy, then we can finance our effort against the pandemic. The suspension of debt payments for the duration of the pandemic and the cancellation of illegitimate debts and those contracted to finance the fight against the virus. So we really have to make sure that the pooled resources that we have are utilized really well for the response to the pandemic, including now the vaccines, because we know the vaccines would really help prevent further spread of the infection and will also prevent serious effects of the disease on whoever gets the disease. So we call upon individuals and organizations to endorse and support the waiver and actively advocate with their governments for the adoption of the TRIPS waiver proposal. I see our friends from PHM Japan in the audience. We also appreciate the work of our colleagues in PHM Japan because they've also been rallying the Japanese government to support the TRIPS waiver. And our PHM colleagues in Indonesia were also very decisive in the campaign for Indonesia to sign the TRIPS waiver. So we hope that this forum can further enlighten also our government officials, and the Makabayan Bloc's resolution can also push our government to support this TRIPS waiver. We have always said that the World Trade Organization should be out of health. In fact, we do not agree with the TRIPS agreement because we have already questioned World Health Organization since 1995, why they agreed to have the drugs and the medicines, health-related aspects of technology to be included under TRIPS, because we are not a trade issue. Health is a life issue. So we're not a simple commodity that you can choose to buy or not. We are something that is life-saving. So WTO, we should not be under WTO at all. The World Trade Organization should not control health. So our ultimate call is WTO out of health. So, but meanwhile, because this is a immediate campaign, then we support the TRIPS waiver. But eventually, it's really TRIPS and other agreements in the WTO that impact on health. It should not be affecting health. So the challenges that we have now, the struggle for equitable access to medicines is part of the struggle for equitable health systems and equity with respect to the social determinants of health. So it's so sad though. We used in 1978, Alma Ata Declaration on Primary Healthcare talked about the need for equality. And now we're just saying equity because the gap between the rich and the poor has really widened so much that we just really have to address the needs of those who need the services most. And that's how equity came in. But eventually, of course, we hope that there will really be equal opportunities and equal access to all for uh, a more health system that is responsive to all. So as part of a long-term solution to the public health emergencies like COVID-19, the government should abandon the neoliberal policies on health. This has been the problem before the pandemic. We really have a bad public health system because we were reverting to privatization of government hospitals and health facilities. And privatization here does not mean private practice. Privatization here is the intent, the what do you call this? The intention of government to renege on its responsibility by budget cuts, and therefore people who go to the public health system are so disappointed there is no medicine, no doctor, that they tend to go to the private sector. And now private sector is dominating our health system because the government has failed to strengthen the public health system. So this under this issue, while we push for TRIPS waiver, we still push for uh, strengthening of the public health system where government should be responsible and should provide for free, quality, and comprehensive health services to the people. So, because medicines and the response to the COVID-19 pandemic is not just the vaccine or the medicines, but it's a more comprehensive health system that should be able to respond in this health crisis. But one critical aspect of why our public health system is very bad is because we do not have our own drug industry, and therefore our vaccine production is also not there. So we're very dependent on foreign pharmaceutical industries to provide these needed medicines and support vaccines to us. So one of the primary calls really is to develop a national drug industry. We used to have the biological section of the Bureau of Food and Drugs and the DOH, as mentioned earlier already by Josh and Sunny, out there in Alabang. But the land was sold in the name of Philippines 2000, where they were selling so-called non-performing assets of government to beef up the coffers of government. But because there was no more land and there was also no technological development, and I support the push for of our friends in the OST and our scientists, the Science for the People, to really develop our own virology institute so that we can develop. We used to have it, now it's gone. And so now we are really at the mercy of the pharma companies in providing the vaccines and needed medicines for this pandemic. So our challenges and goals is to allot sufficient budget for testing, treatment, and control. So we'll have to go back to this more basic health protocols also, because even if we have the vaccines, if we don't continue the physical distancing, the wearing of masks, and avoiding crowds, and making sure that people are tested, mass testing is being done, systematic contact tracing, it will still be difficult pandemic conditions for our country. So even the development of isolation and quarantine facilities must be part of the agenda also of this COVID response. So we should protect our frontliners because they're out there supporting our people. So again, we have to improve our services by providing more health workers, and our health workers have to be supported more by way of allowances, their wages, and the hazard pay that they are supposed to have. So these health implications of the TRIPS waiver are indeed very important at this time. But as I said, we support the TRIPS waiver, but we also support the overall changes in the economic and political structure of our government so that we can really have a better public health system that will be a structure that will support pandemics, whether it's the COVID or other pandemics that will come. Thank you very much.
Okay, thank you very much, Dr. De La Paz, for sharing the health implications, which are really more than the hospitals, more than the medical care, but really the status of our healthcare system as well as the bigger implications in our society. Okay, so with that, we're a little over time, but we can start our open forum. So to help me with the open forum, I'd like to introduce the physician representative of Bantay Bakuna, Dr. Jamie Dasmariñas, to facilitate our open forum for with our speakers, and we hope that our previous speakers can help us in answering the queries of our audience. Okay, all right. So, all right, could we have our speakers on the screen as well? All right, thank you very much for being able to stay during this our open forum for today, even if we are a little beyond our time. Okay, so all right, are there any questions? So you may now put in your questions on Zoom or on our Facebook Live. So, all right. So, Dr. Jamie, are there any questions already from our audience?
From our Facebook.
All right. Okay, I think there is a message in the chat from Yishiori from Japan, from her organization, the SHARE, which stands for Services for the Health in Asian and African Regions. So her question is, she wonders why the Philippines. Would the Philippines really have clear benefits from the waiver? Is that why the Philippines remains silent or not actually supporting the waiver? Are there any opinions from our speakers? Although Representative Rosas mentioned that a lot of our lawmakers seem to not be aware. But from your opinion, do you think is the Philippines not supporting the waiver, or are they silent because they are not sure about its benefits? Would anyone like to respond?
Yes. What I was wondering is, unlike like Japan or US, EU, those countries who obviously would like to protect the benefits of their own country's farmers, Philippines don't have that relations. And then it seems to me, it's only Philippines would get the benefits by the waiver. Why they are not that, eager to support at least, or not to be silent? It's just a wonder.
Josh, can I speculate?
Go ahead.
Actually, it's such a big mystery because it can't be geopolitical because the US is supporting it and China is supporting it. So if these are the two biggest influences, foreign policy influence in the Philippines, so that can't be the reason behind that. If it's not geopolitical, I can imagine there are only two possible reasons. One is sinister, one is a bit more polite. I'll start with the polite one. The polite one might be because our legislators, our government officials, and negotiators are just so convinced by this neoliberal WTO free market hype that they can't imagine anything that subverts the spirit of the free market. So that's my nice, polite, passive explanation.
And that's
My sinister speculation is that who are the biggest beneficiaries from the Philippines right now, not having its own vaccine manufacturing and not benefiting from compulsory licenses or the like, is the big pharma firms. I think just the DOH alone procures about 9 billion pesos a year from Zulig, Pfizer, GlaxoSmithKline and the like. I don't remember how much, but I think it's at least twice that what the private sector purchases in pharmaceutical products. So I can imagine also that that's my sinister speculation that there might be some government officials taking their lead or self-censoring themselves so as not to antagonize the big pharma firms who are actually supporters of PhilHealth and health privatization because it's such a pharmaceutical intensive intervention that you're actually getting a lot from that. So that's my sinister speculation and the polite speculation.
All right. Engineer Ray, would you like to add to that, especially with regards to the private sector involvement that you touched on earlier?
Well, really, although I work with the government, I really can't provide any answer because I'm not the administration. So I'm just your typical civil servant. So, but I guess I would tend to agree with Sir Sandy's observation. But again, those are speculations. So it's just much like I think we're the only country in the world requiring the wearing of face shields. So from there, you could just add to the sentence. Why in the entire world is the Philippines the only one requiring face shields?
The longest lockdown.
And the longest lockdown.
Josh, may I add?
All right, go ahead, ma'am.
Okay, as an advocate, we have been advocating for access to essential medicine since way back. The role of the pharmaceutical industry in the Philippines has really been a very influential role on government. So if Big Pharma is not supportive of this because it's going to run across and cut their profits, then their influence on our government is very strong, so much so that the Philippine government is very ambivalent about supporting it. I've talked with some people in the DOH. To what extent are they supporting it? They keep telling me, oh, we're still studying it. I said, it's very clear. The benefits of TRIPS waiver is there. Why don't we support it? But of course, the influence of Big Pharma on Philippine politics has always been there.
All right, thank you very much, ma'am. All right, I hope. Right, I hope Sherry's question or each question was answered enough by our speakers.
Josh,
All right,
Josh,
Dr. Eleni, yes, go
yeah.
ahead.
Let me take this opportunity while Engineer Isguera is here to ask him, are you pushing for a virology section or in the OST?
Yeah, it's not only a section, it's a research and development.
Research and okay. So what's the prospect right now? Are we going to produce our own? Is there a possibility we will be able to produce again some of our vaccines that we used to produce and more?
Yeah, I'm hopeful that we could get to that. Well, the two routes that we're looking at is one, if it would be legislated. So, of course, it's legislated, no problem. But if it's not legislated, our secretary has confirmed that we could fund they could fund it out of our own GAA, General Appropriations Act budget, like what we've done with a testing facility for advanced devices and materials, like what the OSD has done for a materials development. So I think the current secretary is pushing for it even before, hopefully before the end of his current term.
Okay. We hope it can be done because we used to have BCG, we used to have these biologicals in our what is our ITM now, but
Research,
sadly we did not continue with it.
Yeah, we're attracting some of our scientists who are based abroad, and they're very much interested in giving back to the country. We hopefully, well, again, we would be eventually in the process of hiring about 197 people for that, consisting of virologists, medical practitioners. As I've mentioned in my presentation, it's not only on human viruses for human
Yeah.
affecting human health, but also for plants and animals.
Thank you.
All right.
Let me
Okay.
add to
Yes.
that.
Yes,
Doc
Doc.
Josh. Yes. So the problem is, Doc Lenny, for your question, the
Yeah.
problem is in the appropriations. Actually, I've heard the discussion about that in the committee. The problem is we're gonna have a deficit by next year. So it will really be a big problem for this government to make an appropriations for that. They know that, and they're actually proposing so many taxes to the people for them to be able to what do you call this, survive, no? So in the GAA, it will really be a fight, no? Because I don't think that the government will give this, especially right now, they're not even giving the 10K ayuda for the people. The very basic need of the people to have a to have something, no, in their impoverished condition right now. And then there's this legislation, the virology department, they're gonna have to find out where to get the appropriations needed for that. So Doc, I don't think so na it can pass no, it can pass as as a paper legislation, but there'll be no appropriation for it. So there's a big problem with that.
Okay. Thank you very much for those questions. Dr. Eleni, I hope they were able to answer your question properly.
Yeah.
All right. Okay. There's a question from the chat before we proceed. From May Katsakis from Australia. She's asking, is there a deadline with regards to when we should be able to support the TRIPS waiver, or when it will be when it needs to be approved, for example?
I think there's a WTO meeting in June, this
June.
coming June 8 or 9, was it?
Both
And
pa.
that's where this is going, June 2. And
June
that
8
is
and 9 pa.
8 and 9,
8 and 9. Yes pa.
June 8 and 9. This is the WTO Council. And this is where they will decide, I think, on whether they will recognize the resolution passed initially by India and South Africa and supported by so many other countries. But considering that there are many countries already, I think they will really push that it be put on the agenda. So that's the critical period, the WTO Council meeting on June 8 and 9. So we need to also advocate to our Philippine government to come up with a resolution to support that. So I hope, Arlene, your committee can really push the Congress people to make sure that the resolution is passed earlier so it will be carried on and implemented by the executive.
Yes, we are very hopeful that it will get the ball rolling, because right now there is no immediate response from the government side, and the legislators are just waiting. There is no proactive activities doing. Well, there is no proactive or any commitment at all, from the government and from the legislators. So we really need to get the ball rolling, and this advocacy, this starts it all. So we are also very hopeful that the resolution of the Makabayan bloc will be passed, will be filed, and we are also open for the revisions of the provisions pala. I have to remind the people that is why we presented it to you, because we would like to get your suggestions with regards to the provisions, to the different provisions that we put there. Thank you.
All right. Thank you very much, Ardalen and the Representative Process. Okay. So that is for the question on the deadline. So it's to add as well. The again the WTO works on a framework of consensus. So if they do not reach the consensus, there will be another meeting yet again. Okay. So Dr. Jamie has one question. Sorry, Doc Jojo. Jamie, can you read one of the questions from the chat?
Walang sound si Jamie.
Alright. Sige, I'll read the question na lang po. So, is there a way to challenge the impositions of the World Trade Organization outside the framework of TRIPS, or to challenge the World Trade Organization itself with regards to healthcare?
Is there a way to challenge world trade or
Like,
WTO?
yes, WTO outside the framework of TRIPS. Well, although I think, yeah, is there a way to challenge this hegemony or this concern with regards to a profit outside the framework of the TRIPS waiver?
Well, the WTO was created basically to monitor and support free trade, and the People's Health Movement has always questioned why health was included in it, because we should not be treated as a commodity, because we are not just a simple trade issue. And up to now, we are challenging that the WHO should not have agreed to the proposal of WTO to put medicines under the TRIPS agreement, and even hospital services and others to be looked upon as a trade issue. It continues to be a challenge that the People's Health Movement has been posing to WHO and to WTO.
Okay, from Sir Sunny Africa mentioned that the Australian Trade Minister said that they welcome the US change in position. Yeah, so hopefully we can see more effects now from other countries as well. Dr. Kawili also has a question. Dr. Kawili, would you like to mention this question yourself, or shall I just read the question?
Hi, hello, Josh. Can you hear me?
Yes.
Yes. So I'm saying this from the perspective of an academic who's, well, basically required to think within the current framework of patents and, intellectual property, and on behalf of the institution and the country and so on and so forth. So what seems to be the most viable alternative to the patent system for incentivizing innovations in health? Because that's the thing we always hear from the advocates of the patent system. Like, there is no other viable alternative. But I mean, really, what is the most viable alternative that that we can think of at the moment?
May I share?
Go ahead, ma'am.
In 1994, Bukas, or Bukluran para sa Kalusugan ng Sambayanan, was actively participating in congressional hearings that were looking into the patent protection for drugs. At that time, our patent protection duration was 17 years, and we were advocating to lowering it because studies already at that time showed that research and development costs of drug companies are recovered within 3 to 5 years of their sales. So the proposal then was to lower patent protection to just 5 years. And but of course, Dr. Romy Quijano, we would say no, there should be no patent protection for product and process, because that is something that you innovate because you want to help the people. It's really a service. I mean, the pharmaceutical product should not be seen as a profit-making industry, but a service industry. But people were saying, you're right, Dr. Kawili, that people will have to be incentivized, and what is their return of, how do you also support their return of investment and all that. So in the studies that we were having then was 5 years was enough. So we were advocating for a reduction to 5 years, but we were overtaken by GATT and WTO, and to our surprise, it was extended further to 20 years. So now even with TPP, they were saying that it could possibly even be extended to 25 years. So grabe, the hold of the pharma industry on governments and how they are generating profits for themselves. This is really part of capitalism and imperialism. So they want profits for themselves, not for service to the people. So this is what we need to really raise the issue. Development for whom? Government should really support development for the people. It's not for big business, it's not for profit. But to incentivize them to develop that, I think the fact that they are, maybe it's just really the sense of service, the sense of being able to help humanity. If that can be a value that you are able to instill in people, then development does not necessarily have to be for profit. It is for the development and support to humanity. That could be a good
Yeah,
idea.
yeah. So I mean, just to like, I don't know if, how widespread this is, but I saw this on one of the recent WHO webinars. So they had Peter Singer, one of the bioethicists, talking about the health, the health, what do you call this? Health impact fund, where the the incentivization would be proportionate to actual impact on health on a global scale. And this is supposed to address neglected tropical diseases, among other things, in a way that obviously the current pharmaceutical system is not, effectively addressing. Although I think the main problem really is who's going to pay for it. So they say that perhaps governments or some other mechanism. I think that's the part that just needs to be um, somehow clarified. Yes, thank you.
Yeah. Can I make a very quick comment? I think there's a way to expand the thinking of incentivization beyond the profit motive. First of all, I think there's a very clear example in the case of COVID. It's a very micro study, even if it's so big. The fact that you had over $12 billion in direct government funds just for the COVID response, to do that very quickly, I think that's a good example of public funds not incentivizing but pushing innovation. But also, I also remember this article. I mean, I'm sure it's Googleable. I just have no internet now to do that. At least 5 of the components of the mRNA vaccine were actually also subsidized, the product of subsidized public research in private universities. So I think that's just one little case study. On a larger scale, I think the question is, that's a good question, how to innovate, but it's so understated how public agencies have actually a long record of making very high risk investments, pushing innovation and increasing rewards for society and also for private actors. And I think the most famous example of that is the internet. The internet was by no means a private effort. It was a wholly public funded effort. Of course, down the line in the results chain, it was commercialized, but internet among so many technologies were driven by public agencies subsidizing high-risk investments. Of course, there were failures, but there are also a lot of private sector failures and wastage as well. So I think we should sort of recast the question. It's not how to incentivize private firms to innovate. It's actually how to innovate society. How we do that? The public sector has the key role, the primary role, to make sure that innovation serves the people, not private profit, not corporate profit.
All right, Engineer Ray, would you like to comment before we move on to the last question?
My comment would only be just limit the greed, because well, not necessarily related to what we're discussing. It's just like we're trying to assist a community somewhere in Quezon City, and they're being driven out of that community because of a PPP arrangement between 2 government agencies and a private company. And I was asking, isn't this private company not awash with a lot of profit? Why push out all these people in the community? So practically, that's just limit the grid. And well, one thing we have at the UST is technologies for public good. So for that, we don't charge royalty, or if we do, we very minimal licensing fees for the technologies if it's for public good.
All right, thank you very much to our speakers. I think this will be our last question from Dr. Carpeo.
This is a comment and a question, because we need to learn from what the HIV/AIDS and other support activists did. This is not the first case. It was a victory. We also need to study the impact with regards to, say, will the pharma companies not profit even if it is on discounted or on limited trips. So the HIV/AIDS activists and a movement at that did it. So we can do it now with COVID because it is a pandemic. So the thing is, everybody's voice should be heard and everybody's voice should be registered against the WTO. And we thank the Makabayan for the initiative of the resolution. But you know, Congress also moves when there are, mass gatherings now are still prohibited. So, of course, the most effective will be warm bodies. But can there be warm signatures? Can there be warm Twitter storms? Can there be other creative, fashions that we can show our support to the trip waiver, and that we amplify the people's sorrows and the people's grief over this profit? Let's do it with COVID, then let's do it with other killer diseases as well that have new technologies but are still in the hold of the greedy capitalists. We have hepatitis, we have cancers, but we're still on the old mode of chemo for cancers, whereas there are already newer technologies that could be evened out. I mean, the equity. So this is a really a good grounding issue for us. It might seem so distant, but it is incumbent upon us how we make this or relate this to everyday people suffering. Let's use the COVID and even especially the non-COVID cases, which are also quite affected with the COVIDization of response of the government. Then we take off from that. I think we need the people, we need a movement. So there's a people's health movement in other countries. They are successful. So we need the movement also here in the Philippines to register that voice before June 2 or 9. We have a couple, we have some signatures already supporting other countries, supporting this, but we need to amplify those efforts. We need to really do it en masse. If not, then our voices or our stands are not registered even before that crucial period of June 7 or 9. So that's all.
All right, any comments from our speakers? And perhaps also your parting words, since we're a little short on time already.
Yeah, the PHM has launched a global signature drive in support of the PHM statement on the TRIPS waiver. So we hope other countries would really support it. But here in the Philippines, maybe we can. It's so difficult because you cannot go out and you cannot really have a face-to-face discussion with people. But we can maybe be more proactive in this and reach out to more maybe DTI and to other government officials to explain what this is all about. If they still don't know it, then also them ask for their support.
Okay, so as parting words from our speakers before we finish.
Yes, very short, very short, because I am in session right now. I have 2 gadgets with me, so I do not know where to listen. Last parting words. Really, we need a government that will respond and commit to the people's right to health. So that is very basic. No? And actually, all our efforts, if we put it together, I think we're going to make this really the outcome of this will be helpful to the Filipino people, no? And we hope that this small gesture of having the resolution passed, it is a great effort to our people. Thank you.
Right, thank you, Rep. Process. Sir Sunny or Engineer Esguerra before we finish?
Okay, very, very quick. I think we the deadline isn't just by the WTO. I think time's running out. The longer the pharma firms can delay this, if they can delay the waiver by December, that doesn't give much time actually for new manufacturing capacity to build up. So our worst case is they let the waiver pass. The WTO looks nice because they allowed that kind of exception. But in practice, the pharma firms still don't share technology. They still don't support the production of materials, and then they block it. So actually, I think that'd be the worst thing all around. So the time pressure is on us. I think we should really push not just this government, but all governments to do something about it, because they shouldn't fool us that the WTO is anything actually magical. Thank you.
Engineer Esguerra?
Although not a fan of WTO, but I guess the the waiver really is very important right now. But maybe I hope through our little effort at our organization, the Pro People, engineers and leaders, maybe hopefully we could help out. And I've just recently asked Mr. Sunny about if I could use some of his slides in our discussions at our organization. So hopefully we could work more with helping the people really realize that, as Dr. De La Paz mentioned, that health is not a commodity. Really, it's a right. Thank you.
Okay. All right. Dr. De La Paz, or is that enough already?
I just want to say that we really have to work hard on our government now before June. But regardless of what the outcome is, I think we should always push our government to prioritize the people. And even in their approach now, they're just relying on the free vaccines from COVAX. The government should spend really for providing whatever is necessary to address this pandemic. Huwag na nating tipirin pa ang mga tao. The people should have the best that they need at this time. And government has that money anyway. They have trillions of loan. They use it for the people.
Right. Okay. So thank you very much to our speakers, Dr. De La Paz, Engineer Esguerra, Mr. Africa, and Congresswoman Brothes. So we hope everybody had an enlightening evening with regards to our discussion on the TRIPS waiver. We will, of course, this will not be the end. For a lot of the questions, we can further add to your knowledge since the campaign. This is only a starting off point or jumping off point for our campaign for the Philippines to recognize the TRIPS waiver among our larger campaign to realize the right to health. Okay, so to end our discussion, I would like to call on as well, again, the physician representative of Bantay Bakuna. If Dr. Dasmariñas would like to just add a few words before we finish.
Oh, hello.
Yeah.
Can
Yeah.
people hear me now? Oh my
Yes,
god.
better, Jamie. Go ahead.
So there. Yeah. So we thank you for our speakers for addressing the problem regarding the TRIPS waiver. So again, it's a race against time, especially for the masses, because we can see that the government still our other responses to the health crisis. We can see that they're still just banking on the vaccines, and to further escalate the call for it. I hope you watch out for the online campaigns that will be conducted by the CPRH and the Bantay Bakuna Network. So on Twitter and on Facebook, please watch out for it. We'll announce when the hashtags will come out and the statements to be shared will come out. So thank you again.
Okay. All right. So thank you, Dr. Desmariñas. So before we end, we just like to again mention this is our starting off point. We want the TRIPS waiver to be realized more by our government. As mentioned, not just the NTF, the IATF, the Intellectual Property Office of the Philippines, the DOST, the DOH, and the DFA, but more importantly, again, the Philippine Permanent Mission to the World Trade Organization, who will be directly involved in this vote in June 8 and 9 in the World Trade Organization under Ambassador Tihanki. No, so we will be launching our campaign with this. After this webinar, we will do social media and physical campaigns similar to the other organizations in solidarity with them. Hopefully, we will launch a Twitter rally or social media rally on the 29th of May, 10 days prior to June 8th. So that is something we look forward to. We'll be sharing on our network, CPRH, Bantay Bakuna, CHD, and the People's Health Movement Philippines, the mechanism on which we will do our Twitter rally, as well as other campaigns that we will push our government to realize there is a need towards this TRIPS waiver. Okay, so we are again calling for the Philippines to support the World Trade Organization TRIPS waiver now and equitable vaccine distribution now, among the many other rights to health that must be delivered equitably and justly to our Filipino people during this pandemic and during this crisis. Okay, so this is where we end. Again, thank you very much to our speakers. This has been the TRIPS waiver in the Philippines, a forum on the economic, political, and health implications. On behalf of the Coalition for People's Right to Health, Bantay Bakuna, the Council for Health and Development, and the People's Health Movement Philippines, thank you very much for your attendance. Again, many thanks to our civic media partners, Now You Know and Rappler Move PH, for helping us cover this talk and our launching of this campaign for the Philippines to explicitly and commit to the implementation of this TRIPS waiver at the World Trade Organization and realizing our right to health, whether or not there is a pandemic. So thank you, everyone. Good night. Good evening.